Hi there, Dr. Mina Merholm, board certified psychiatrist. So I hope you had a wonderful 4th of July weekend. Hope it was an awesome time of fireworks and explosives and barbecue and all that kind of great stuff. One of the things that I've been asked a little bit about today is, sometimes with celebration time, whatever time of the year it is, there's a little bit of different ways that people celebrate. Okay, it's 5 o'clock somewhere, everywhere. So sometimes we can see in those situations, hey, we interact with a family member and say, this person seems to be kind of celebrating more days of the week than I would think. It seems like they might be struggling with something, might be struggling maybe with alcohol, might be struggling with any kind of substance. And when somebody asks me is the only way to treat folks like that or to help them seek care, to go to like an AA meeting, to go to an AA, NA, any kind of anonymous where you're encouraged to never use a substance again? Yes and no. So the big thing that I want to share with you today is if you or someone else that you know are struggling with, whether it's alcohol, even marijuana, even though it's legal everywhere, but sometimes there can still be problematic use, or any other kind of substance, there's often medication that can really help with that. And that's the reason that's really, really important is the biological part of this, the addictive nature of some of the things that we're talking about, anything from, cigarette smoking to alcohol or more. There's a physical tone that it takes on your body, and it's hard sometimes to just not use it just because you want to, just use on willpower. And the thinking for us in substance use and in psychiatry in general has been to have a little bit of an emphasis on will. That's great. To have a little bit of an emphasis on support around you. That's fantastic and really important. A little bit of an emphasis on the human connection, which is important and critical. A little bit of an emphasis on spiritual care, your spiritual community. That's huge, really, really important. And also a little bit of an emphasis on what we can do physically to help your body not fight you in the whole process. So I encourage you, if you're struggling with this, don't be first ashamed. This is not a moral issue, not a moral failure, not a disappointment that you're bad, but rather it's something that's a real struggle, and it's something that has real biological basis from a disease standpoint that makes it very hard to quit. So there are resources, and those resources, as I said, cover the gambit between all these different parts of make you who you are. Okay, but don't forget today the part that I wanted to highlight, in addition to your social, spiritual backup here, is what medicine can do as well. Sometimes there's a medicine that can be taken once a week, once a day, once a month, and it can really go a long way. All right, talk to you soon.